vaccinate ours. And so, that's the best expression I can give you my opinion. It's much more important, I think, what you think as a parent than what you think as a public official. And that's what we do. But I also understand that parents need to have some measure of choice in things as well. So that's the balance that the government has to decide. But I can just tell people from our perspective, Mary Pat and I have had our children vaccinated, and we think it's an important part of making sure we protect their health and the public health.
Now, he has to be very careful. He has to be very careful because as someone who's in the conservative wing of American politics, there are many people in the United States who believe vaccination is a problem, that it can lead to illnesses, it could be about state control, it's government intervention. We're talking about this because down in the States, I always get Disneyland and Disney World confused. It's the one in California. There was an outbreak of measles, some cases in Canada as well, and there has been a renaissance of the anti-vaccination movement. It's a strange alliance, actually. It's people in the Christian right, both evangelical and Catholic. It's left-wing hippies. There are people who watch too much daytime TV, and they've combined to resist vaccination. I am a huge supporter of vaccination. It has saved hundreds of millions of lives. Justin Trottier worked for several years for various secular and humanist organizations. He now works for a men's health group. You've also worked very hard to make fun of, to expose, to mock, to deflate those people who have alternative health solutions and panaceas when they don't work. Now, you're not a doctor, neither am I. I pretend to be one. But in terms of vaccination, is vaccination, mainstream vaccination for things like measles and so on, is it potentially harmful?
There can be side effects to the actual vaccination. Usually it's just inflammation at the site of the actual vaccination itself.
Well, that's nothing.
Which is nothing, right? But if you look at the effects of not getting vaccinated, if you look at the return of some of these outbreaks, I mean, we had actually more or less eradicated measles, more or less eradicated polio, especially in the West. And now we're seeing recently an outbreak of up to 100 cases in the States, the one you're referring to. Just a couple of years ago, we had some minor flare-ups in Ottawa and in Vancouver. So the tragedy is that this is entirely preventable. And we know that the science is very clear that vaccination is not 100%, but something like 95%, 97% successful in preventing these potentially terminal diseases. And so the tragedy is people should know these things, and we're not really getting the information out in an appropriate way.
Mm-hmm. The risk of serious damage being done to a person by vaccination, it does exist. It's more than just a swelling, but it is tiny. Absolutely tiny compared to the likelihood of death. In measles, the infection rate is enormously high. I mean, it's so contagious when it was unchecked, and death would often occur.
Well, look what happens in parts of the world where it's still not completely, under control. You do see fatalities in high numbers from measles.
And polio. Now, I grew up in the UK. I can tell you, in Britain, I was born in '59, and till around that time, polio was incredibly common. You would see people walking around with frames around their legs because they contracted polio, which is very contagious. It was only in the 50s that people were screened for it and then vaccination.
President Roosevelt, for example.
Yes, but that was before my time, by the way.
A little bit before your time.
I'm incredulous that people today honestly believe that vaccination and this nonsense, this pernicious nonsense that autism is caused by vaccination. The man who put this idea forward, well, he went to prison.
When we talk about side effects from vaccinations, you're right that they really are, very mild, if anything.
And if they're severe, they're incredibly rare.
That's right, very, very rare. Contrast that with the idea that autism is linked to vaccination. There is 0% chance that is correct. As you say, the Wakefield, the fellow who was sort of responsible for some of this so-called research, he had his license to practice medicine removed. He went to jail. He was actually found to have been on the payroll of law firms which were cashing in on parents going after the providers of vaccines, alleging that the vaccines had been responsible for harm to their children. So he was actually making money off of this fraudulent so-called research.
But so what do we do, though? And this is where it becomes very interesting. I think amongst intelligent people, I'm sorry, there is a consensus vaccinations are a good thing.
Yes.
What do we say to the parent? What do we do to the parent who says, not getting it done?
I don't think we can force parents to have their children vaccinated. That's not what I would advocate. I think it's a public a public awareness campaign that we need. I think Health Canada, if we're talking about Canada, Health Canada, the public health agencies of Canada and its provinces do need to do a better job of informing citizens. We also should take advantage of the fact that while rates of trust in most professionals is in decline, people still do trust doctors and pharmacists. They should be more upfront about this.
What about the baby? Certain vaccinations, too young to have certain vaccinations. So
That's right.
There's a baby, say in a doctor's clinic, and there is a boy there who is contagious because the parents say no to vaccination. If that child is infected, I mean, there are potential problems here. Personal responsibility.
Absolutely. And what you're saying, if you're not going to have your child vaccinated, is that somehow the health and welfare of the community, of all of those, let's say those kids, those newborns of that community, is less important than the health of your own child.
Yeah.
Of course, parents care deeply about their own children, and they should. But you should also realize you live in a community. Everybody is benefiting from so-called herd immunity, which is compromised when we don't have something like 95% vaccination rates. We're actually slipping below that in some parts of the country.
If a child is in severe need of chemo or blood transfusion, parents say no, the state can intervene. I mean, there's legal precedent.
That's right, or blood transfusions.
Can't intervene if the child says no to vaccination. The state can say, sorry, the child's having a vaccination.
Right. I think what we need to do, again, it's public education. I think also when it comes to allowing children to enroll in schools, I think there the state can say, look, you want to take advantage of a public benefit, namely public education, then you as a member of the public do need to.
What the parents refuse to do.
Well, but then you're penalizing other children, right? Because you're putting their health at risk. It's a difficult
It's a
decision.
very difficult one. I mean, as you say, education. I wish people could realize. I mean, it's not going to make you a communist. It's not going to make you a criminal. I mean, that's how ludicrous it is. Really, these vaccinations are for your benefit. I wish people could embrace this.
We have seatbelt laws. We have
let's not get into that. That's a different issue.
But the state does have some role to play. And we can debate where the line is drawn, but some role to play in public health.
Appreciate it as always, my friend. Thank you so much.